what if we had no current healthcare system? How would we treat chronic patients? And as many of you may realize, the answer to that question, at least in the researcher's head who was behind the research, was not to say this is done perfectly in the current healthcare system. No, they took an approach where they said, let's try to break down the barriers between the patient in their home and the hospital, the outpatient clinic, and the emergency room. So that research was initiated in 2014 between a number of municipalities in the Copenhagen area, the University of Copenhagen, and a number of, in this case, pulmonologists, lung physicians. And the conclusion they reached in the research was the Epital care model, a 6-step model where you kind of break up the barrier between the patient in the home and the hospital and the outpatient clinic. In step number 0, you can say that the patient is potentially in risk, undiagnosed for lung disease, which is the current focus we have. In step number 1, the patient's health literacy has increased and the patient is able to do things on their own. They're knowledgeable about the disease. They know when they have a worsening or exacerbation, they know what to do and they can handle on their own. In step number 2, they are supported by a call center, which will not only answer calls from the patients, but they will also reach out to the patients based on measurements which the patient do in their own home. The patients have a home kit. In the case of COPD lung patients, the home kit consists of a tablet, a spirometer, and a pulse oximeter. And in step number 3, the lung physician and the COPD nurse steps in and support the call center or get in direct contact with the patient. Step number 4, they can go to the patient's home, a forward reaction team. And step number 5, we have had forward acute departments in the municipalities where the patient can be brought to and be stabilized. And only in step number 6 do you see the hospital having a role. This model, which has been in use in projects in Denmark for 7 years now, proves to be very efficient. We are seeing that when patients are enrolled, onboarded, so to say, their contacts and need to contact hospitals and outpatient clinics and emergency rooms goes down drastically, between 50 and 75%. And there's a very good reason for it, because this mechanism empower the patient. They give it insight. You can say, in a way, in the current healthcare system, when a lung patient have an exacerbation, what they can do is call an ambulance and go to the emergency room. When they're knowledgeable, they're supported by the call center and the physicians, and they're able to take action themselves. And the consequences that worsenings are discovered very early, at a very early stage. Interventions can be made at a very early stage, and that keep them healthy and avoid these exacerbations to develop to something that is a more serious infection and need treatment by the hospital. There's now also, because this has been running for some years, some good evidence on what it means to patients. The quality of life increase, the life years quality, according to the quality standard, increases. And for the healthcare system, we have evidence for general use of telehealth technology in Denmark in big-scale projects, suggesting that we save 1,000 euro per patient per year. In the national business case, the estimate is 1,500 euro. And in the latest results based on the Epital care model, the estimated saving is 2,300 euro per patient per year. And there's a good reason for this, because the savings are coming from the hospital side. You all know that can we save an inpatient stay of 2 or 3 days, or even an outpatient visit, or a contact at the emergency room, it makes a big difference. As part of the study, they also took one particular patient and meticulously followed all contacts during the year for that patient. Afterwards, they could see that the number of contacts fell to almost zero. What was interesting was that during the year they followed, the patient had actually traveled 2,900 kilometers to different departments. So there's actually also a green effect in treating patients this way. Delivering healthcare to chronic patients this way also allow us to collect data on a much detailed level that we do today. Our patients, they measure themselves once or twice every day. They're mandated to do that in order to be able to track their disease very closely. And that means that we are collecting 75 data points per patient per day. That is a perfect data background to use predictive health. So at the moment we are testing prediction technology in order to not only react the moment we see a red condition from a patient, the same data has been registered, but also being able to forecast this patient is in high risk of a red condition in 1 or 2 days. So the call center and the physicians actually can act even more proactively. And as you can imagine, there are even more potential to this kind of algorithms and predictive health technology, also in the details of medicine use, what is most efficient, the view on the patient's mental health. Anxiety is often an issue with these kind of chronic patients. So definitely when it comes to chronic disease management, treating patients in their own home, I think for the first time during the last couple of years, we are now seeing solid evidence that there's a huge benefit for the healthcare system, for the patients, and also in terms of how many years the patients live healthy with that disease.